Good evening, all. Thank you, Faye, for the kind introduction. And I would like to thank Dragon Claw team for giving me this opportunity to be able to share my journey as a lupus patient. My name is Prudencia Francis. I was born in the Philippines. I have a bachelor's degree in science and chemistry and also did a course of Mastering Advanced Export Operations Certificate at the College of International Business Victoria Limited, established by the Australian Institute of Export Victoria Division. I used to work I used to work at the Australian Embassy in Manila, where I met my husband. He was posted in the Philippines as an immigration officer. Before I joined the Australian Embassy, I was working as a teacher. We moved back to Melbourne, Victoria at the end of the posting in June 1983. We started having a family and gave birth to our son. During my delivery, I lost a lot of blood and was given 2 units of blood transfusion. During the process of transfusion, I had convulsion and was literally held down by 2 or 3 nurses to help stop me from shaking. I remained at the hospital for 11 days for observation. I had fever for several days. When I finally settled down, I was discharged and sent home. A month or 2 later, I became very ill with a flu-like symptoms and was diagnosed as having glandular fever. I had the feeling that it was more than that, so I sought a second opinion from another GP. That time, I started developing butterfly rashes, and my GP immediately ordered me to have a complete blood test. And as soon as we received the blood test results, I was referred to see a rheumatologist. This is when I was confirmed that I have systemic lupus erythematosus. My specialist put me on prednisolone right away. I had to stop breastfeeding because I was taking high dosage of cortisone, which could affect my son's health. I continued to see my lupus specialist as an outpatient for a while, and 7 months later, my husband was assigned for an overseas posting. The Department of Health was consulted regarding my health condition, whether I was safe to travel. So after a few tests and consultations with my specialist, I was approved to travel and the diplomatic mission proceeded as directed. After a few months of posting in Copenhagen, I began to feel ill again. I was nauseating and having flu-like symptoms, so I went to see the designated physician of the Australian Embassy with a letter from my rheumatologist providing them with full medical history of my lupus. I was put under observation, had a complete blood test again, and the results showed that I was pregnant. My joints and face started to swell, and I was retaining a lot of fluid in the body. This is when I was made to make a choice. The first choice was to have my pregnancy terminated. The second choice, in order to save the fetus, I had to give up taking lupus medication. But I was very sick, and to stop taking the high dosage of cortisone wasn't an option. If I stop taking my medication, there is a possibility that both fetus and I might not survive and would leave my 10-month-old baby grow without a mother. It was the most difficult, very sad, and traumatic decision that my husband and I had to make. Our physician from the embassy referred me for admission to the hospital and proceeded with the termination of my pregnancy. After the procedure, I was having difficulty processing my loss. and went to severe depression, which triggered my lupus into full-blown flare-up. I was readmitted back to the hospital for treatment, and everything went wrong. All my plumbing stopped working and my stomach swelled up like I was 9 months pregnant. I had difficulty breathing because of the fluid in my lungs. That time, I had nephrotic syndrome, severe swelling in the extremities, both feet and the hands, toes and hands, and also puffy eyes, ankles, and weight gain. I had cutaneous vasculitis, a condition where blood vessels in the skin become inflamed. And the worst one was ascites. Ascites? How do you pronounce ascites? Abnormal buildup of fluid within the peritoneal cavity, the space between the lining of the abdomen and the abdominal organs. That's why my tummy was swelling like a 9 months pregnant lady. Anyway, I was dying. At that time, I thought I couldn't survive. That was my first near-death experience. The team of doctors who were looking after me consulted my husband if he was willing to sign a document to proceed and treat me with their last option, which is the shotgun treatment, and discussed with him all the expected side effects. One of them was psychosis, which can last for a few days. The treatment was a series of 1,000 milligrams of cortisone injection administered in 3 consecutive days. They told him that they can't guarantee whether it was going to work effectively and save my life. My husband's response was he was going to sign the document if there was a glimmer of hope to save my life, and he did. I was at the hospital for almost 3 months and spent Christmas on my hospital bed without my family. When I was eventually able to get up and out of bed, I couldn't walk, completely disorientated, and didn't know which one was my left or right foot. I was skin and bones with no hair and had dry, scaly skin. I was scared to look at the mirror. I couldn't recognize myself. But I was grateful and thank God that I survived miraculously and was able to hold my young son again. After having few intensive sessions with my physiotherapist and became strong enough to travel, we came back to Australia and was admitted to hospital straight from the airport for further observation and treatments. My lupus specialist took over and did his best to get me back to almost at a manageable state so I could go home and be with my family again. I remained as an outpatient for a while, and that was the period when my specialist recommended to consider other options. I was referred to take lessons on meditation to deal with my anxiety and depression, which I did and found it beneficial up to this present time. Other options were to try naturopathy, acupuncture, Chinese medication, homeopathy, and I also tried kinesiology. These alternative options were not covered by Medibank Private at the time, but we were prepared to try anything to get me back to normal life. These alternative options came with a high price, draining our financial resources. My specialist also had a group of fantastic clinicians and allied practitioners, such as physiotherapists, occupational therapists, dietitian, psychologists, psychiatrists, neurologists, and dermatologists, as well as ophthalmologists, to deal with all the complications that I was going through and experiencing during my worst state. I was also advised to check in at a rehabilitation center yearly for a month each time, and continued to have these treatments as an outpatient after my discharge to help me recover quickly, spiritually, mentally, emotionally, and physically. In 1987, I developed a vascular necrosis on my left elbow and left hip. I had surgery to remove the piece of cheekbone in my elbow, and soon after recovery, I had the total hip replacement done. I was at the hospital for a month because I developed a complication. I had rashes on my face due to allergic reaction to a rubber mask that was used during the surgery. It was indeed a very long recovery process. When I finally recovered from this major operation, I began to feel better and was able to manage my lupus with lower dosage of prednisolone, and was taking Voltaren, Celebrex, hydroxychloroquine tablets, along with my regular physiotherapy, regular exercises, such as hydrotherapy, modified yoga, Pilates, and therapeutic massages. In 1988 to 1998, my lupus was under control and manageable. I wasn't in full remission, but well enough to go back to the workforce. I was fortunate and blessed to keep working for almost 10 years. And while I was at the prime time of my career, I started flaring up again. Physical and mental exhaustion from work contributed to the trigger of the flare-up. I struggled to work full-time as I requested, so I requested to work part-time instead, and continued to do so until I couldn't continue working anymore. I even tried to just do on-call consultations or work for a few hours to train or work as a reliever, but eventually had to totally give up work because I just kept going back and forth to the hospital. In 1998, my health started to deteriorate. I had pulmonary fibrosis. My joints were inflamed, swollen, and started to deform progressively. My wrists, fingers, and toes were deformed. During this period, I was prescribed to take alendronate, known by the brand name Fosamax. It is a biphosphonate medication that treats and prevents osteoporosis, to take once weekly, and was taking it for several months, but was stopped due to intolerable side effects. I also had Arava and methotrexate for a while. Again, due to side effects that didn't agree with my system, I stopped taking them. I was referred to see a hand surgeon specialist and foot surgeon specialist to try and fix my badly deforming extremities. Several surgeries were performed. I had fusion on both wrists and operations for my fingers. After I recovered fully from several surgeries on my hands and strong enough to handle another procedure, I was then referred to have total forefoot reconstruction on both feet, which was a painful, challenging, and long recovery process. While recovering, I contracted infections on my foot, so I was readmitted back to the hospital. My surgeon had to do debridement to clear the infection, and was treated with antibiotics through intravenous injections. It wasn't easy for the whole family due to very limited movements. I needed to be carried into and out of a wheelchair. I needed 24-hour care for a long period of time. My husband then decided to give up work so he can take care of me as well as manage household work, household chores. As you could imagine, the stress, disappointments, tears, and all these experiences took a toll on everyone in the whole family. And my journey with systemic lupus erythematosus had a very difficult impact to the whole family, emotionally, mentally, physically, as well as financially draining. Despite of all these trials, our whole family tried to hold on together and made us even stronger with the help and support of other family members and close friends. The supplemental treatment options that I have undertaken were meditation to focus one's mind for a period of time in silence or with the aid of chanting for spiritual purposes or as a method of relaxation. I have naturopathy. It's a system of healthcare that utilizes natural therapies to support the body's innate ability to heal itself. It emphasizes a holistic approach to health, considering the physical, mental, emotional, and spiritual aspects of an individual. Acupuncture, a form of complementary medicine in which fine needles are inserted in the skin at specific points along what are considered to be lines of energy meridians, used in the treatment of various physical and mental conditions. Acupuncture helped me with the Bell's palsy that I had, which happened twice every time I had major operations. Homeopathy, I had that as well, and alternative medicine based on the theory of treating like with like, claims to stimulate healing responses to diseases by administering substances that mimic the symptoms of those diseases in healthy people. The effectiveness of homeopathic preparation is disputed within medical science. Kinesiology, in the context of health and wellness, is a complementary therapy that uses muscle testing to assess imbalances in the body, including structural, chemical, and emotional aspects. It's a holistic approach that aims to identify and address underlying stressors to promote overall well-being. And the last one I had was traditional Chinese medicine. It is a comprehensive healthcare system with a history spanning over 2,000 years. It focuses on maintaining balance and harmony within the body, mind, and spirit to promote well-being. Self-efficacy management with permanent disability. I manage my pain by having daily meditations and prayer, 1 hour meditation and 1 hour prayer. That I do that first thing in the morning. And when I'm in pain, I take Panadol. If the intensity of the pain that I'm having at that certain period of time, I would take Panadol Forte. And along with that, I have physiotherapy as required, Pilates as required. No, I have Pilates twice a week, podiatry as required, and I also have counseling as required, and having good healthy diet. I am currently detoxifying for over 2.5 years now. and totally off lupus medication. I am taking supplements to maintain a manageable health by taking the following: 3,000 milligrams of fish oil daily, 7,000 milligrams of vitamin D twice a week, 1,000 milligrams of vitamin C once per day, Super B complex once daily, and I have adopted the gluten-free diet and avoiding processed food as much as possible. My goals is to advocate excellent communication between treating physicians, clinicians, and patients. Second one is to educate ourselves as patients by doing more research and obtaining all available resources to have a better understanding more on autoimmune diseases, discovering cures, and hopefully prevention in the future. And these are achievable goals by supporting one another, including working together in collaboration with medical experts, science researchers, and of course, to have adequate financial resources. And this is why I also volunteered to participate and joined ALRB, the Australian Lupus Registry and Biobank for lupus patients. I am grateful and feel blessed that I'm still alive and reminiscing the ups and downs of my lupus journey, especially during family gatherings. My husband used to make a joke that if they tried to bury me, I would dig my way out just to be with them and keep fighting, and that is me. Instead of feeling sorry for myself because of my disabilities, I've learned to focus more on the things that I can do rather than my limitations, and mindful for the things that I can be grateful every time I wake up. Dealing with my condition one day at a time. I remember Dr. Daniel Lewis, my specialist for over 30 years, once told me that if I can live and deal with things one day at a time, I can also learn to live one moment at a time. And thank you. I'm really grateful with my specialist who really looked after me very well, because I'm still here talking with you now. Thank you so much. I thank you so much for lending an ear to my story or my journey as a lupus patient. Thank you.